Understanding rheumatic fever is crucial for students studying medical conditions. This educational guide is designed to help you grasp the complexities of rheumatic fever, providing you with the knowledge and tools needed for academic and clinical success. Rheumatic fever can be a challenging topic, but with the right information, you can gain a comprehensive understanding of its management. Rheumatic fever is a significant but treatable illness. It is an inflammatory disease that can develop as a complication of untreated or poorly treated strep throat or scarlet fever. The bacteria responsible for these infections, group A, Streptococcus, can trigger an immune response that mistakenly attacks the body's own tissues. It can affect the heart, joints, skin, and nervous system. The inflammation caused by rheumatic fever can lead to long-term damage, particularly to the heart valves, a condition known as rheumatic heart disease. This makes early detection and treatment critical to prevent serious complications. Rheumatic fever is a complication that can occur after a strep throat infection. Symptoms of strep throat include a sore throat, pain when swallowing, fever, red and swollen tonsils, and tiny red spots on the roof of the mouth. If these symptoms are present, it is important to seek medical attention promptly to prevent the development of rheumatic fever. This illness primarily affects children and adolescents, typically between the ages of 5 and 15. It is less common in adults, but it can still occur. Children in this age group are more susceptible due to their developing immune systems and higher exposure to strep bacteria in school and social settings. It is more common in developing countries. Factors such as limited access to healthcare, overcrowded living conditions, and lack of awareness about the importance of treating strep throat contribute to higher rates of rheumatic fever in these regions. Efforts to improve healthcare infrastructure and education are crucial in reducing the incidence of this disease. Early diagnosis and treatment are crucial to prevent long-term complications. If rheumatic fever is suspected, a doctor may perform a series of tests, including throat cultures, blood tests, and echocardiograms to confirm the diagnosis and assess the extent of the disease. Prompt treatment with antibiotics and anti-inflammatory medications can help manage symptoms and reduce the risk of permanent damage. This educational guide aims to provide students with essential information about rheumatic fever. By understanding the causes, symptoms, and treatment options, you can play a proactive role in your academic and clinical pursuits. Knowledge is power, and being informed can help you make the best decisions in your medical career. We will discuss its causes, symptoms, diagnosis, treatment, and long-term management. Our goal is to equip you with the information you need to recognize the signs of rheumatic fever early, seek appropriate medical care, and support patients through their recovery. Together we can work towards a healthier future for all individuals affected by this condition. Rheumatic fever develops as an immune response to an untreated or partially treated strep throat infection. Strep throat is a common bacterial infection that primarily affects the throat and tonsils. It is caused by the group A Streptococcus bacteria, which can spread through respiratory droplets when an infected person coughs or sneezes. If left untreated, the bacteria can trigger a more severe immune response. Group A Streptococcus or gas bacteria cause strep throat. These bacteria are highly contagious and can easily spread in crowded environments such as schools, daycare centers, and households. When someone is infected with strep throat, they may experience symptoms such as a sore throat, fever, swollen lymph nodes, and red or white patches on the tonsils. It is crucial to seek medical attention if these symptoms are present. Instead of attacking just the bacteria, the immune system mistakenly attacks the body's tissues. This autoimmune response can occur when the immune system confuses the body's own cells with the invading bacteria. The antibodies produced to fight the strep bacteria may cross-react with the body's tissues, leading to inflammation and damage. This misguided immune response is what ultimately causes rheumatic fever. This leads to inflammation in various parts of the body, including the heart, joints, skin, and brain. The inflammation can cause a range of symptoms such as painful and swollen joints, a characteristic rash known as Erythema marginatum, and involuntary movements known as Sydenham's chorea. The most serious complication of rheumatic fever is rheumatic heart disease, which can result in permanent damage to the heart valves. It is important to note that not everyone who gets strep throat will develop rheumatic fever. The risk of developing rheumatic fever depends on various factors, including genetic predisposition and the presence of certain strains of the bacteria. Maintaining good hygiene practices, such as regular hand washing and avoiding close contact with infected individuals, can help reduce the spread of strep throat. However, prompt diagnosis and treatment of strep throat are essential to minimize this risk. Antibiotics such as penicillin or amoxicillin are typically prescribed to eliminate the bacteria and prevent complications. It is important to complete the full course of antibiotics as prescribed by a healthcare professional, even if symptoms improve. Early treatment can significantly reduce the likelihood of developing rheumatic fever and its associated complications. Recognizing the signs of rheumatic fever is crucial. Early detection and treatment can prevent serious complications and improve outcomes. Rheumatic fever can manifest with a variety of symptoms, making it sometimes challenging to diagnose. These symptoms can vary in severity and may affect different parts of the body. These symptoms usually appear a few weeks after a strep throat infection, which is caused by the group A Streptococcus bacteria. It's important to note that not everyone who has a strep throat infection will develop rheumatic fever, but those who do need prompt medical care. Common symptoms include fever, joint pain, swelling, redness, and warmth in the joints. The fever can be quite high, and the joint pain can be severe, often moving from one joint to another. The pain and swelling often affect multiple joints, especially the larger ones like knees, ankles, elbows, and wrists. This migratory arthritis is a hallmark of rheumatic fever and can be very debilitating. Other symptoms may include chest pain, shortness of breath, fatigue, skin rashes, and jerky, uncontrolled movements known as Sydenham's chorea. Chest pain and shortness of breath can indicate inflammation of the heart, a serious complication known as carditis. If your child experiences any of these symptoms, especially after a sore throat, seek immediate medical attention. Early intervention can prevent long-term damage to the heart and other organs. Rheumatic fever is a serious condition, but with prompt treatment, most children recover fully. Doctors will typically perform a thorough physical examination and may order several tests to diagnose rheumatic fever. These tests can include blood tests to check for inflammation and infection, as well as an electrocardiogram, ECG, to assess heart function. Blood tests can reveal elevated levels of certain markers that indicate inflammation, such as the erythrocyte sedimentation rate, ESR, and C-reactive protein, CRP. A positive throat culture or rapid strep test can confirm a recent strep infection. An echocardiogram, which uses sound waves to create images of the heart, can help detect any inflammation or damage to the heart valves. This is crucial for determining the extent of the disease and planning appropriate treatment. Treatment for rheumatic fever typically involves antibiotics to eliminate any remaining strep bacteria, anti-inflammatory medications to reduce inflammation and pain, and sometimes medications to manage heart symptoms. In severe cases, hospitalization may be necessary. Rest and supportive care are also important components of treatment. Patients may need to limit physical activity to reduce strain on the heart and joints. Family support and education about the disease are essential for managing the condition effectively. With proper treatment and care, most children with rheumatic fever can return to their normal activities and lead healthy lives. However, it's important to follow the doctor's recommendations and attend all follow-up appointments to monitor for any potential complications. Education and awareness about rheumatic fever are key to prevention and early detection. Understanding the symptoms and seeking prompt medical attention can make a significant difference in outcomes. If you suspect your child may have rheumatic fever, don't hesitate to contact your healthcare provider. Community health initiatives and educational programs can also play a vital role in raising awareness about rheumatic fever. By spreading knowledge and encouraging early treatment, we can help reduce the incidence and impact of this serious condition. Remember, early recognition and treatment of rheumatic fever are crucial. With the right care, most children can recover fully and avoid long-term complications. Stay informed, stay vigilant, and prioritize your child's health.